So our first question is like, what's your name and what did you major in college?
My name is Nava Yeganeh, and I majored in history.
So currently, what's your occupation? And if you don't mind, could you share like what you do?
Yeah, I'm a pediatric infectious disease physician, and I work for the Los Angeles Department of Public Health. I'm the medical director for vaccine preventable disease control.
How long have you been working in this occupation?
About 3 years, I've been working for LA County. I've been the medical director for the last 14 months.
What inspired you to like pursue a career in STEM?
Yeah, so I think I'm someone who is always looking for a way to contribute productively to the world. And so there's a lot of different ways of doing that. But for science, I feel like most scientists are trying to help in some way, trying to make the world a better place for the next generation. I was also really interested in international work and international health. I came from a different country. I'm Iranian, and in my country, there was a lot of diseases that were preventable that people were getting. So I became really interested in seeing if you could prevent the disease, especially in young children.
That's really cool. Thank you. What do you most enjoy about your work? Is it like being able to help people, kind of like what you mentioned before?
Yeah, I think what's exciting for me is that we're taking like things that are done in a lab. So, a vaccine is created by a group of scientists, and then we're explaining to the public how to use it and when it should be best used, and looking at all the data and trying to figure out which population should get it. And then we're implementing it. So we're actually making sure that people are able to get the vaccine, are able to give the vaccine. So right now that's really exciting because like you're taking something that's made in a lab, you're helping doctors get it into their clinic, and then by doing that, you're able to like change the way the health of children are, and the public is. So it's like seeing the entire continuum, all the way from like the little test tube all the way to getting rid of a disease.
So this question kind of varies from like in time. Is like, did you have any women in STEM you looked up to when you were younger, or like even some that you look up to today? Because I know a lot of people when they were younger, they didn't really see that many female role models in the STEM workplace or yeah,
Yeah.
STEM
I
in
can't think
general.
of anyone when I was younger that I was looking up to as far as STEM. I think there was a lot of people who were really wonderful leaders. Now I have a lot of great woman mentors. And they do different things. Like some of them are in medical education, and some of them are scientists, and some of them are great leaders. Some of them are great communicators. So they just have a lot of different roles. But yeah, all of them are great mentors. And it's nice to have such a variety of great mentors, because you really can like ask for more than one opinion, especially I feel like I'm really interested in trying to improve some aspect of my professional life.
It's one thing that you would like to you would like to tell like younger girls who are interested in STEM and like any advice you would like to offer them.
Yeah, I think it's one of those fields like, well, I do think art is really important in creating beautiful art, but I do feel like science and technology, all these things are ways that you can contribute to the world in a really positive way. And so it's just a really like huge privilege in a lot of ways to be able to somehow hopefully make life a little bit better for the next generation of people. So definitely, I'm really a huge fan, and I think everyone should consider it, women and boys, but yeah, everyone should get into STEM. But again, I would think I would kind of do a STEAM thing where I think art should also belong in there somewhere.
Yeah, so like people can like discover like a multitude of things that they're interested in.
Yeah, and also it's like both, like it's such an important part. Like you don't want to just focus on science without the other aspects. You want to have a balance between science and ethics and beauty. All these things kind of should work together.
Okay, and then our last question for you is like, what's a challenge that you've had to overcome in the duration of your career? Because I know that like COVID-19 was a pretty big thing and that probably impacted your career, right?
Yeah, I think COVID-19 was difficult, but in a lot of ways, it was a way for me to use all the skills I've learned. So, someone who was interested in infectious diseases, who had worked with viruses, who was interested in public health. So COVID-19 was a chance to like use all of that together. I think one challenge that a lot of people feel when they're in medicine is an imposter syndrome, where you feel like you're not good enough and somehow you got through the door, but like you don't know what you're doing. And so, being living with that kind of discomfort, but like looking past it. So having the resilience to be like, all right, this isn't like my area of expertise, but I'm going to do my best and I'm going to learn from this experience and I'm going to do a better job next time and kind of moving ahead that way.